All right, we'll start with the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Morning, everyone. Thanks for showing up on this cold day. Welcome to the Shawnee County Board of County Commissioners work session. It's January 26th, 2026. First thing on our agenda is the Extension Office quarterly reports. So, Candace, you're on.
Good morning, Candace Stiles, Shawnee County Extension Director. I'm actually going to start this morning with Sofia Diaz-Buezo doing an update on the expanded food and nutrition program.
Good morning. Just like Candace said, my name is Sofia Diaz-Buezo, and I am the Expanded Food and Nutrition Education Program Extension Agent here in Shawnee County. And today I'm just going to talk about what our educators have been doing in our community. So FNEP contributes to the health of Kansas by helping low-income families enhance their nutritional well-being. But FNEP is so much more than that. It strengthens communities, it builds skills, and delivers measurable public impact. Currently, our FNEP collaborates with 11 organizations in Shawnee County to extend its reach and strengthen community support. We are a trusted community resource. Our participants know that our educators are really well connected with our partners, and they come to us for questions when they are inquiring about resources in the community. Our educators understand and respond to audience needs. So our programs are both designed based on participant feedback and cultural relevance to ensure its meaningful impact. And we also have data-backed outcomes. So evidence shows that improved food resource management, healthier lifestyles, and measurable outcomes for cost savings for families. Our participants over the last year were able to reduce their food expenditures by $162.50 monthly or $1,950 annually. And this is because of the strategies that educators use in our classes to teach about food resource management. So FNEP impact. So this programming can help reduce healthcare costs, enhance productivity, and foster community engagement. This programming helps improve food security. It utilizes community resource and tailors approaches to diverse cultural needs. I wanted to put here our impact for last year. So we had 411 individuals receive nutrition education. That's 113 adults and 298 youth in our schools. 426 total family members were reached. So while we are directly giving education to youth or to parents, we also know that they have family members at their home that they're sharing this information with. 74% identified as Hispanic or Latino, and 65 were pregnant. 95 of our adult graduates improved food resource management. 99 improved their diet quality behaviors, 72 improved physical activity behaviors, 93 improved food safety behaviors, and 49 improved food security. For our youth graduates, 47 improved food resource management, and that number is low because mostly their parents are doing the food resource management, not them, but they're still able to participate in that with their parents. 83% improved diet quality behaviors, 76% improved physical activity, and 63 improved food safety. So these are some of the programs that our FNEP educators have been doing. So they are currently at Grace Med, parents as teachers, and at Pauline, and both have 501s. For our youth, we had September and October session at Jordan Middle School with our 8th graders. And then starting tomorrow, they're going to be at French Middle School for 8th graders. And on Friday, they will be starting a session with Jordan Middle School for 7th graders. In April, they will be at TCAL with their culinary students. And here are some pictures of the things that they do with the students. It's very hands-on. We equip the youth with a lot of skills for them to be able to feel more confident in the kitchen and be able to take this home and do it with their parents, teach their younger siblings, which is a lot of the things that we heard from them, and just make it fun for them as well. And then these are some of the programs that I have participated on over the quarter. I went to the resource fair at Williams in November. I conducted a lunch and learn cooking demo for the Child Care Aware. And then I had a teaser session for Dining with Diabetes at the library. And then I'll be starting Walk with Ease next week with Parks and Rec, which is fun that you guys are here. And then here are some pictures of what those different events have looked like. Okay, one of the things that we are also asked to do is policy systems and environmental initiation projects. So over the last year, we have worked with SENT, Southside Filling Station, to do a community garden for their farm to food truck inclusive workforce development program. We really had a lot of ups and downs from like weather to just being able to order equipment. But I'm glad to say that we are we're able to do 12 raised beds. And we really put a lot of work, not only us, but our horticulture agent was also involved in this project to make it available for anybody in the community. And then here are the pictures of what that looked like. We had a lot of volunteers come. We had organizations donate seeds and donate dirt. We got a grant as well to be able to do and purchase all of the equipment that we needed. Okay, before I finish, I know you guys were at our breakfast in December, and I got to share an impact story from Jordan Middle School. So I decided to share something else with you guys today as well. So this one is from the Parents as Teachers program that we offer in October. So we were able to offer Create Better Health curriculum. This curriculum helps families build skills for healthy eating and meal preparation. The first session always features a Create a Skillet Meal activity, introducing families to the foundation concepts of balanced meals and simple cooking. During this lesson, a father and his 7-year-old daughter volunteered to help prepare the meal for the class. The participation sparked a new family routine. The mother shared that their teamwork reflected their family tradition of cooking together. They recently made a chicken, rice, and broccoli skillet at home, which was quick and easy. And the daughter has asked them ever since to make meals like that more often. They also decided to increase their physical activity, and they, obviously during the warmer months, they were going out on hikes as a family about 3 or 4 times a week when the weather permitted. So it just shows the impact that our programs have in the community and how much they appreciate as well. So, thank you.
Thank you. Sophia?
Yes.
Mr. Chairman? So, this may be a bigger conversation, but recently we received an email from the health department. They were going to close out one of their registered dietitian positions due to a lack of funding. It had been open since March of last year, but they do have 5 registered dietitians in the women, infant, and children's area. Where does FNEP and the registered dietitians overlap? In that I think that if you're working with 65% pregnant individuals or family expecting, it would seem that you're working within the same groups.
Yeah, so that's a good question. So the way it works, as I understand from my educators, is that whenever they are seeing clients at GraceMed, they quickly refer them to WIC. So they are able to do more of a referral system. A lot of the clients that go to GraceMed, they are prenatal, they're in the first trimester of the pregnancy, and so they always connect them to the WIC dietitians to make sure that even if after they deliver, they have a connection of the health department and be able to participate in that program.
And I guess my question really is what you're doing with Kansas State Extension and FNEP different than what the Women, Infant, and Children is doing with the health department? Or are they really the same program but offered to different groups?
They are different programs, yes. So FNEP focus more on, FNEP back in the day used to be a home visitation program. And then a lot of things happened, a lot of things changed over the years, and now it's more of an educational program. While WIC, they do more of the one-on-one with the moms, with the kids. They do a lot of like biometrics and a lot of the health outcomes with them, more than we can do, because they're registered dietitians, yes.
Given that they're different programs, I'm surprised that you're not working directly with WIC to enhance your program.
We do. We actually offer a program or a curriculum called Healthy You and Baby Too.
Okay.
And so we are able to participate in some of the sessions that they have with the moms when they have mom groups.
Okay,
Yeah.
great, thank you.
I see the federal government came out with a new food pyramid recently.
Yes, they
And
did.
it sort of turned things a little bit upside down. It sort of follows what I'd call the low-carb diet or the Atkins diet kind of thing. Has that made its way down to Shawnee County and
Yeah.
what we talk about?
So as of right now, we haven't really received any direction from FNEP, like at a national level. It takes about a year to update any curriculum, and that's what the universities are working on right now, to be able to incorporate those updates for the curriculum, the classes that we teach. We have been given the instruction to continue to teach the way that it is. If people ask questions, we have a guide for our educators to be able to provide those updates at a more easy way for people to understand what the changes are and how they might look. But I also want to say that my plate was, and for a long time it was, it still is a good resource to be used. A lot of people understand what my plate looks like because that's what we eat from. We eat from round plates. So just to be able to incorporate those changes in the educational portion might take a little bit of time, but we do have a resource for educators.
Yeah. I'm just always amazed that I remember, obesity is just so rampant in this country anymore. When I was a kid, we didn't see that.
Yeah.
Back, of course, that was a number of years ago, but still, what happened? I mean, it just seems like we just didn't see much when I was in grade school and in high school. And now it's just, I don't know.
Yeah.
If it's processed foods, it's we eating more sugar or whatever, I just don't know. But I think nutrition's critically important to this country, and we need to stay on it and figure it out.
Yeah, and so is education. I think that's why we play a big role in the community, to be able to bring that education to the members and the family and the participants that we serve. So,
Okay.
yeah.
Thank you very
No,
much.
thank you.
Okay, so at your places, I did provide our paper quarterly report. That comes from all the agents. Agents do anywhere from 3 to 5 pages each quarter. I've picked a paragraph for you, so I can get you more information if you'd ever like that. But for our fourth quarter, we did have 1,312 direct educational contacts. These are the people that we gave programming to, we collected demographic information from. It's not just counting the phone calls or that just need redirected or things of that nature, but these people were receiving education from our programs. So in the 4-H youth development area, Grace had a school out program, school time out. We had that week off for Thanksgiving in November with the 501 schools. But she went to the Boys and Girls Club Teen Center and did a robotics program. And we think a lot of different things when we think of robots, so I included a picture of what they were working with. It's a ball. It's called a Sphero, and they had to program the Sphero to run a maze that is mapped out on the floor. So the topics were writing code, troubleshooting code. When you thought it would do one thing, you make it hit go and it doesn't do that thing. What happened? And then finally navigating the maze with the robot, and she was happy to report that all 3 teams completed the maze, and most of the students had no coding experience when they came into the activity. So that was pretty fun. STEM education while they're at a school that's also pretty interactive. In my area, Community Vitality, in November, I had the learning sessions for the Youth Pitch Contest, which was business pitch. This year I heard someone thought it might be about the card game pitch. And I was like, nope, it's business pitches. And then in December, we had the contest, which was a partnership with the Shawnee E-Community Partnership. We were at TCALC. We had 7 youth participate, and they pitched their business concepts. And some of them were pitching working businesses that they're actually doing. And we had 5 different Shawnee County schools involved: Highland Park High School, Washburn Rural Middle School, Washburn Rural High School, Hayden, and Seaman were all participating, and we awarded $2,500 in prize money that was sponsored by Go Topeka. So that was exciting, and it was a fun night for the youth. In Family and Consumer Sciences, Agent Adelaide Tompkins completed her first Medicare Part D prescription drug plan open enrollment counseling sessions. That is a big program in that area, and she had 163 in-person counseling appointments during that 2.5-month time period, and she's estimating that her clients had $25,000 in planned savings. So they compare what they're doing versus what might be out there for the drugs that they're taking. And she had 3 or 4 really involved cases where people were in like facilities and getting really different drug type treatments. So 163 is pretty impressive for one person to do during that time, considering how complex some of them can be. Lane Weems had 17 new Master Gardener volunteers complete the basic training course for 2025. That is the biggest number that he's ever had, and now a quarter of the Master Gardeners have come in the 3 years since he has been the horticulture agent. So that's exciting as well. But their impact this year, they had 8,124 volunteer hours doing education through horticulture in Shawnee County, and as a group they completed 1,422 units of advanced training. So you study up big time when you enter the Master Gardener program, but they do continuing education for all members throughout the year, and they have a minimum number of education requirements to stay in active status. So they're a really great resource for Shawnee County. And then just some other activity that happened this quarter. We had our annual meeting November 10th where our new board was sworn in. Our county clerk was there to help us with that. And that picture is the 2026 Shawnee County Extension Board that had their first meeting just a couple weeks ago. We had our celebration breakfast December 3rd, where we recognized our Friend of Extension award winner was Community Resources Council this year. We utilize a lot of space in their buildings for VITA. I'm blanking now. The programs that Sophia does. I'm missing something, sorry. But we utilize their space, and Mary is always super open and hospitable for when we have programs that need a home. And then while actually in this quarter, we did participate in the Topeka Farm Show this year, our new ag agent starts in February. Terry Casey will be here mid-month. But this year, I was really lucky to have Dr. Warner from K-State and Jill Barnhart, the ag agent in Coffee County, really rally around us and help get the people to work the K-State Extension Farm Show booth. I can set up the table, I can put out the flyers, but when the first person comes with an ag question, question, I need help. So the K-State and area agents came in and helped us out with that. And then I'd be glad to take any questions you might have.
No?
Oh, you
Thank
gave
you.
Sophia all the hard ones.
Thank you.
All right, thank you.
All right. Our next presentation, Parks and Recreation.
Good morning, Commissioners. Tim Laurent, Parks and Recreation. We just wanted to come up today. I have Brian Sturm with me from Landworks Studios, and Brian's going to give a little presentation on where we are with our master plan process. We've been meeting weekly, and I think we've already accomplished quite a bit. But with that, I'm going to turn it over to Brian, and then we'll be happy to answer any questions that you guys may have.
Thanks very much, Tim. Thanks very much, Commissioners, for your time this morning here at your work session. As Tim mentioned, our consultant team has been working on a regular basis with his staff over the last 2.5 months to get started on this master planning effort. We'll just go over a few of those items with you. Just want to keep you all abreast of the process as we move through it. This schedule sort of lays out on kind of a monthly basis the various phases of our plan. And of those 5 phases, we're coming to sort of a close of the first phase, which is the initiation phase. And we'll be moving on here soon to the discovery phase. We hope to be ultimately back in front of you with a completed report in the fall. But we'll be back a couple of times before then to just continue to update you on our progress. Based on the discussions we've had so far, and we've had obviously a number of discussions with staff, we've also had an opportunity to get in front of the Parks and Recreation Advisory Board, the Parks for All Foundation. Last week we had our first full meeting with our Master Plan Steering Committee. So based on that engagement, we've come up with at least preliminary objectives for this master plan, things we've heard over and over again. And certainly that includes providing broad engagement options throughout the process. I'll go into a little bit of detail on that soon because that's one of the biggest portions of the project we're about to begin. We want to be able to build awareness of all the opportunities that the Parks and Recreation system offers. We want this master plan to help foster and promote more interagency cooperation amongst the various departments within Shawnee County and even certain select departments in the Topeka municipal government. We want to help define what the community needs are, and ultimately want to provide a strategic roadmap, something that helps this department make prioritized decisions over the next 10 years. So things that we've accomplished during the initiation phase of the plan include generally providing some graphic branding for this master plan and graphic standards for the document as we start to build it. We spent this time developing a demographic profile of Shawnee County that included looking at some recent plans, but also just extracting data that's available through the federal government and various census-related websites. We've been reviewing some of the most recent plans developed by the county and in some cases city of Topeka, just to get an overall context of the planning environment right now in which we're doing our work. So that includes things such as the Shawnee County Pedestrian Master Plan, numerous neighborhood plans produced by Topeka and as they relate to parks in those parts of the city. We'll also be looking shortly here at the Shawnee County Trails and Greenways Master Plan. All these things help, as I said, give us a context for where the city and the county are right now in terms of green space planning. We've spent time with the staff just verifying a variety of information that would include things such as the recent past few budgets for the county, staff numbers, recreation program participation rates over the last 3 years, as well as just getting our minds around the the physical assets of the department, from the various parks, tracts of park land, indoor facilities from community centers, to, a variety of buildings such as the Great Overland Station or the Helen Hawker Theater. And we've also been configuring our various platforms for community engagement, which we'll be rolling out here in the next week to 2 weeks. So those next steps are generally heavy on engagement, as well as system assessments. By the end of this week, we'll have a survey that's going out in the mail to thousands of residents across the county. That survey will be, a paper, physical form that folks get. They'll be able to complete it several ways, whether that's filling it out with pen or pencil and putting it back in a postage-paid envelope, or going online to a website listed at the very top of that survey, or even picking up the phone and responding to the survey over the phone. And that provides several different language options for residents as well. But that's just one of the tools. We're also launching by the end of this week a website that we've been working on that will be an online engagement platform folks can take advantage of for the next 6 months. It'll be open to the public February, March, April, May, June, July. We'll probably close that in early August. But that'll allow residents the freedom to really take part in not just that survey, which will be included in that website, but also an interactive map, and several other features, as well as a schedule of the process so folks understand where we are at. On February 4th, that's next Wednesday, we're going to be hosting an in-person community open house. We'll be doing that at Big Gage Shelter in Gage Park from 6 to 7:30 on Wednesday the 4th. That'll be a fun event. We'll have a brief presentation just to orient folks who come to what the master planning process is about, why we do it, what goes into it. But we'll also have a number of interactive sort of engagement games and stations so that folks can physically take part in some of the questions we're asking folks, and have a chance to just speak with people on the consultant team or Tim and Jessica's staff. So we're looking forward to that. Those are always fun events. We'll also be beginning our park and facility assessments in the next month. We'll be starting with indoor facilities in February while we have the opportunity to do that. But over the course of March and April, we'll get out to all of the parks and all the other facilities as well. And later in the spring, one other engagement feature of the plan will be facilitating a number of stakeholder focus groups. That's where we have the opportunity to speak with specific groups of folks who have, partnerships or allied interests with the department. Those could include neighborhood improvement associations, folks in the community health field, folks who are on, the various school districts that this department partners with, folks who are passionate about certain recreation or sports pursuits. We could end up speaking with the Topeka Sports Commission, or even clubs associated with things such as dog parks, disc golf, mountain biking. But those will take place during this next phase as well. We've got some more information about some of these steps. I've sort of been speaking through, I guess, this part of the process, or this part of the presentation. Like I said, that survey goes out in the mail later this week. We would expect to have all the completed responses we need to sort of get to that statistically valid point sometime in March. And we'll have a full report of all those results by mid-April. This text sits on top of the home page for this website that we are working on and hope to publish later this week. Like I said, that'll be available for folks to make use of for a good 6 months. Numerous ways for folks to interact with the process. And I don't want to leave out that we're working with Parks and Recreation and their marketing department to promote this website through a number of different avenues, using email blasts to the over 8,000 folks that they have in their email list, also using social media platforms to get the word out about this website. The staff there has been tremendous in working on that effort. We're doing some of the same things to promote this open house that I mentioned that'll take place next Wednesday. We look forward to that opportunity to get in front of people and answer their questions and interact in a in-person manner. Yeah, and like I said, there are we'll be starting the park and facility assessments in February, and those will go all the way through the end of April. Stakeholder focus groups will be something we'll be working on March and April. Those are great opportunities to get a tight group of folks and get some real discussion about the issues that they feel are important to them when it comes to interacting with this department and this community. That's what I have for you all today. I hope to get back in front of you all at the close of this next phase, probably sometime in early to mid-May. But please let me know what questions you might have at this point.
Go ahead. Oh, okay. Forgive me if I didn't hear. I think it's important to meet up with the Gage Park Improvement Authority. They're going to have a
Yes.
They're going to have quite a role in our future, as well as the zoo. Even though it's not part of the county, we're attached at the hip, and their future plans are going to affect Gage Park. A lot of it that we're probably taking care of at this point.
Yeah, and I know Brian was about ready to tell you, they're on our list. I mean, that's a group we're definitely going to be in front
Figured
of.
they were.
They're helping to fund part of this plan, so for no other reason, we'd like to get their feedback. And then also on the zoo, just to let you know, we had the zoo come give us a presentation at our Parks and Rec Advisory Board this month and sort of update the board on the projects they're working on and how they might impact Gage Park. And so you're right, we do work very closely with the zoo and the Discovery Center. So they're definitely involved to some degree in this plan.
Very good. And I was glad to see all the different organizations and groups you're working with, and that your recent trail plan.
Yeah.
Be a good.
Yeah, we finally got the plan last Thursday maybe. And so I think that we will get, like, I think I mentioned this last week, we like to get in front of this board and let you see the plan and adopt that here in the next few weeks.
Okay, be great. Anything else?
Look forward to it.
Thank you.
All right,
Thank you very much.
guys.
Thank you all.
All the work on this. All right, we're down to public comment or staff comment. Anyone? All right, Commissioner Cook,
Stay warm.
Commissioner Mays.
Yeah, ditto.
I'll go along with that. That sounds good. All right, do we have a need for executive session? We do not. We do not? We're adjourned.